So what makes an ideal candidate for PRESBYOND blended vision treatment of presbyopia, treating aging eyes? So the ideal patient has a significant problem, significant issue, significant compromise of quality of life, and realistic expectations. That's your ideal patient. And the reason I have to say those two things is because I have a range of options for treating presbyopia, which are very safe, very effective, life-enhancing. But none of them are time traveling back to being 21 years old again. They all involve some element of compromise. And that results in two things. Firstly, that there needs to be a significant issue. So occasionally a patient will come to see me in the clinic and they've just started with their presbyopia symptoms, but actually most of the time they can see very well. They hardly ever need to use spectacles. And the situations they describe frustrating them can be remedied by putting a better light on the task. And for that patient I'll say, look, I'm not saying there's no issue here, but it's relatively mild, and my advice would be to leave things alone. I think you're okay for now. When things have moved on and we have more of an issue to address, it's really compromising the range of focus, the range of function, it's really compromising someone's quality of life, making them feel old, stopping them doing the things they want to do, absolutely, we can help. But all of the technologies involve a process of adaptation. For example, with PRESBYOND blended vision LASIK laser eye surgery, the vision is really excellent on day one. But it takes about 6 months for it to feel completely natural for a patient. Over that period, there'll be times where it can feel like the eyes aren't quite working together, that they're not quite gelling. Only transient, just short episodes. And those episodes become shorter, less frequent, less severe as the weeks turn into months, until eventually it is seamless and comfortable. But I do have to ask for people to be a little bit patient just through that period of adaptation as the eyes settle down and as their brain tunes into the range of focus that the PRESBYOND is giving them. So that's really key, that the patient has a significant issue and that we can have a good discussion about where they are and how I can help and how that treatment process will work for them and how we're going to move them through it.